Hi, Dr. Regan Robertson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
So what's really cool about PRP, I just saw it this week on today's Thursday. On Monday, we pulled the teeth of this lady, and then we the next day saw her back for the post-operative check because we put her upper denture in, and there was it just honestly, it looks like it's a week healed.
Welcome to the Everyday Practices Podcast. I'm Regan Robertson, and my co-host, Dr. Chad Johnson, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take right into your own dental practice. If you're ready to elevate patient care and produce results that are anything but ordinary, buckle up and listen in.
Welcome to Everyday Practices Dental Podcast. I am your host, Regan Robertson. I am coming to you this snowy afternoon in the beautiful San Juan Islands of Washington State, here joined with my wonderful, magnanimous co-host, Dr. Chad Johnson. Hello, Chad.
From the snow desert of Iowa. Yes. Doing well, you Story Brand jacket person, you.
That's right. I'm coming up on my fourth year as a Story Brand guide.
I love it.
I know. I just got invited to the party, the kickoff party.
We're going to help people. That's cool. I didn't want to skip over that, but we're going to help people today become the hero, even though the patient should be the hero. But how can the dentist become hero of the day? One way that I would recommend is using Platelet Rich Plasma, or PRP. Also known as, in two different camps, there's PRP people and there's PRF people, Platelet Rich Fibrin. And it's all the same thing, unless you ask a really, really nerdy person that says they're different. And I don't believe that they're much different. And Dr. Garg would agree with me too. But the PRP people are more apt to say there's no difference. And the PRF people say, no, it's spun different. But the fact is, it's getting platelets or fibrin to the top and of the blood vial, and at the bottom you're leaving the red blood cells, and then you can use the PRP/PRF, which now the rest of the podcast I'm more comfortable calling it PRP, but if you don't like that, switch the F at the end and then smile. So the PRP is something that you can use basically to concentrate the healing growth factors and stuff like that. So that way everything heals quicker in, for example, an extraction site. It helps promote collagen growth. It is something that you can use as a dermal filler. You can use it for microneedling or microdermabrasion, where you go in and you use a dermal roller and you dribble the PRP on the face and then roll it into the skin. You can press it and use it as a membrane. You can use it to cover over a sinus perforation. You can use it for a lot of different things. And it's just, what's cool is it's a clot, but instead of having red blood cells, it's just the platelets. So your blood is always having, the way I look at it is your blood always has two main categories that are mixed together. And so you have red blood cells, which bring oxygen to your body. And most of the time you don't need all the healing stuff. It's just kind of floating around there ready to be used. And then when you separate them out by using a centrifuge, and you get the platelets, and you leave the red blood cells, which are bringing oxygen to your body, you now have the concentrate of the platelets. Something else, Regan, that's interesting is when you're a baby, your platelet count is super high, and when you're super, super old, it's really, really low. And that's why
Of course.
babies, yeah, like when Gabe first cut himself when he was like 2 or 3 weeks old with his fingernails, like a day later, it's healed. It's
Yeah.
like, how in the world? So what's really cool about PRP, I just saw it this week on today's Thursday. On Monday, we pulled the teeth of this lady, and then we the next day saw her back for the post-operative check because we put her upper denture in, and there was it just honestly, it looks like it's a week healed. What I remember, what used to, it looked like at the 1 week post-operative mark is now kind of what it looks like when you put the PRP into the sockets, you put the denture right in, you see them back the next day, and it looks really good. It doesn't look healed, but it looks 1 week healed at 24 hours. And those are rough numbers for
Wow.
me. I mean, like someone might say, no, the science says that it's actually just 4 days healed. I hear poo-pooers and nay-nayers, or whatever we want to call them, of PRP say, well, it doesn't
Are there
heal.
naysayers of PRP?
Yes.
Oh,
And the I don't think the people, well, for example, I'll step on toes. It seems like there are some periodontist groups that are like, PRP doesn't actually help, and if you mix that in, you're just wasting time, and you're just trying to pay, like use more of the patient's money. You're just trying to use it as a scam, but it's not actually healing stuff. I think the science shows that, so far as I know, that the bone doesn't necessarily heal quicker, but the gums do. And so it's
the
funny.
soft tissue.
Correct. It's a soft tissue healer and accelerator. Whether it actually accelerates the growth of the bone, I think is debatable. And the good news is, I don't care. Like, I feel like it does, but I could be convinced otherwise. And to me, getting the soft tissue to heal over your bone graft is just as important. That we get a nice quick heal. And so I'm all PRP. Regan, I think that's where I finish my diatribe, my monologue. What questions do you have? And these are for the listeners' advantage, for the dentists who are listening on board. I suppose their spouse might be stuck in the car listening to a dentist podcast, and here we're talking about, stuff. But PRP has patient advantages. You were talking about, you knew someone that was interested in, even hair regeneration, and 2, 3, upwards of 5 visits, you can inject it under the skin where you want the hair to get more dense. I guess where the hair loss has completely happened, it won't necessarily grow hair back where it is bald, but where it is balding, so where it's thinning out, it helps bring hair back into that region. And so for, there's a lot of regenerative purposes for it.
Are you done now?
No. One other thing. 7 years ago, when I got in a burn accident, Dr. Garg actually got a hold of me on a text and said, you should have them use your PRP and put it over your burns, because it's going to help, heal it quicker. And, the hospital never brought that up. I mean, I thought it was.
Did you do it? Did you use it?
No, he sent me a video, of them using it. And I just, I think I was already almost healed by the time he was like, hey, have you tried the PRP? And I was healing okay as it was. But I thought it was interesting that the burn unit didn't offer it as a possibility. I mean, don't you find that interesting? Listen, I loved my hospital that took care of me, did a fantastic job. The nurse, Monica, I still want to give a shout out to. She did a fantastic job, an angel there. I mean, like, they both were awesome. And I brought them donuts at my, whatever few months post-operative visit because they did a fantastic job from Yarsma Bakery, the best bakery in Iowa. And yeah, but after that one, I think I'm done now. You better cut me off before I think of another tangent.
You sure?
I'm not positive.
This is a great transition because you hit my passion point. How come the hospital never offered it to you as an option? And it doesn't have anything to do with the hospital, but it does definitely hit my passion point of why don't we know these things as really well-informed humans? Why don't we know these things? For example, one, I am completely fascinated at how the body can heal itself and how we as humans have come in and figured out there's ways to help that using our own body. For example, Chad, I have 2 children. First child, gets a diaper rash or whatever. What do you use? What do you use?
Remember Desitin?
Desitin, right? Desitin. It works, doesn't, whatever. Use that.
Sure.
Second time around, I happened to find out magically through a friend. Did you know that since you're nursing, you can use breast milk and it works even better to heal a diaper rash?
No,
and I said, I'm sorry, what? Yeah. Did you know that?
No, I had no idea. No.
Oh, I called it miracle juice after that. It healed any diaper rash. In fact, I lent it to friends who had kids with diaper rashes that were not like nursing. I was like, try it. Pink eye. It helped on pink eye. Who knew at all? I had no idea that breast milk
must
could
be
be
the
used
antibodies in it.
Now, I haven't, somebody go science it for us. I haven't looked up the lectures to see what the proof is on it or not. But, there's some things where I think a placebo effect could be. But if you have a kid with a diaper rash, you're going to know if something's working or not. And you're going to want it taken care of. And it was like lickety split. So yes, that was a fascinating, really, really opened my curiosity to understanding how the body heals itself. So PRP, I have heard anecdotally from people in my circle. They've used it on hip joints as well. So easing arthritic pain, if you've had surgeries, different things like that. And I was talking to someone who has a severe back injury. And that was my question was, I wonder, have they brought up PRP therapy at all? And the answer was no, we don't even know what that is.
Yeah. I think,
and so I'm very curious.
Knows about it. I think what's interesting is PRP was a dentist developed.
No way.
Yeah. And so, like hospitals started using it after dentistry had proven its efficacy. So
there's health applications to it and there are cosmetic applications to it. And so I love
which is health. I mean, some of it might be superficial health, like as far as your skin health.
Chad. Yes. I love where you're going with this.
But it's still health nonetheless. And when I'm saying superficial, I'm not saying like, look at my cute purse superficial. I'm talking about just not deep into your, like it might be as surface layer as your skin, but that's still collagen rebuilding. It's still health.
So the applications that I have seen for PRP, like you said, range from, from the facial and the dental applications to the hip joints to, I was telling you earlier, to vaginal health, to the head, to hair. So I just think it's absolutely fascinating, but I don't hear a lot of people talking about it. So when you you mentioned off podcast, did you just apply this? Like you just do this as part of your services for patients? Is this something that you talk to them about? Do you charge them extra for it? Does insurance cover it? Those are some of my questions.
Great. I don't know the answer to any of those questions. No, I'm just kidding. First off, yes, I charge the patient $20, which is quite nominal. For PRP to be drawn. Other people, charge $300 or whatever. My thing is I charge $20 in essence to pay for the vials of blood and, like the supplies. I mean, and not even my time. I mean, but the cool thing is the patient benefit is super high. I also don't really make it an option. So when I want to use it, I just say, you're getting PRP, it's $20 more. And it's just, if someone just wants an old school extraction and they want the cheapest, I know that they're wanting the dirty, cheap version. They just want the tooth pulled. Then I'll just pull the tooth. I can tell, or we talk about it, that they just want the tooth pulled. Anyone else though, if it's a consideration that they want extraction to eventually become a site where an implant will be, or no one's going to put an implant into wisdom teeth, but I'll put it into wisdom teeth areas. So that way, it heals up quicker. There are times when an extraction has infection in it. And rather than just letting it fill with your regular blood clot, I'm going to remove the red blood cells, which are the oxygen carriers, and just have it all plasma, which is the healer stuff. That's how I overly simplify it, is I'm just taking out the stuff that your body doesn't need while it's healing and putting in just the plasma, which is the healing stuff. So, so to answer your question, yes, I charge the patient. It's a nominal fee. I make it pretty standard, but if I've chosen not to, so when I say standard, it's not 100% of the time, but it's basically something by default that we add into. So if the hygienist is planning an extraction and we haven't really talked about itemizing everything, they know that I want to add Medrol as an anti-inflammatory, unless the patient is diabetic or a few other, possibilities of reasons. So by default, Medrol I'm using as an anti-inflammatory, and we are putting in PRP. Whether I do an extraction with bone graft is a different story, like depending on how infected it is. But if after I've curettaged out the extraction site, got rid of the periodontal ligament, I'll put in PRP, and sometimes I'll mix the PRP in with bone graft, put that in there, and then put a PRP membrane over the top and suture that down. That's how that works. I mean, just so that way people kind of have an idea of the nitty gritty.
I find this to be enormously compassionate of you to do it. I think I suppose if you had to have a selfish component to it, it increases the chance of healing faster. So that would be your benefit to it.
Yeah, I get a better implant site, and the patient is not calling me on the weekends as much. Just everything about it is, yeah. So one could look at it as like this becomes a philosophical point, right? Everything that you do that's altruistic has also got a selfish motivation. Okay, call it what you want. Yes, I'm glad that the patient is healing better, and call that selfish of me. I don't know. It sounds silly, but fine,
no, I find it to be, that is the nuance I'm trying to communicate with this PRP therapy. There is, I do go to business applications. Obviously I do, because we have to think about it from that. Like what are you getting from it, from the other angles of it? Like I try to see it from all angles, but to me, the way you describe it is just so incredibly compassionate, because you're thinking about the patient and their entire journey with this healing process. How do we make it easier for them? How do we make it more beneficial for them? Then what does that do in turn for you? It makes the site easier to navigate. I find it to be absolutely exceptional care. And it, I don't remember off the top of my head what your one-liner is or your mission statement. But I remember, tell me what it is. Yeah. We slay disease. God, it's so perfect. Is that not like just perfect?
Yeah.
I love this. So how did you learn about PRP, and then what classes did you take to put it into play? Doesn't sound like it's too difficult.
No. So personally, I went to Arun Garg in Miami, and I actually I did his coursework there on it. And I want to say the actual phlebotomy stuff is a day and a half or maybe 2 days or something like that. It's really not, long. It's also part of his coursework, the continuum. So he has for his coursework, the continuum is the first 8 days. It's like 2 days, 2 days, 2 days, 2 days. So it's 4 weekends of implant beginners stuff. And then he has a master's course, which is 2 days, 2 days, 2 days, 2 days, that is going over more difficult bone grafting, more difficult this and that. And he's talking about platelets and bone biology and blood biology the whole time. So there's that. I've also taken my assistants to when he goes to Chicago and he goes to other towns and stuff like that. And he had the instructors teach it to my assistants, so that way they could draw blood, and that has to be approved per state. And just for the Iowa listeners, it is now approved for assistants to to do the PRP blood draw, the phlebotomy part of it. Yeah, so I mean that's how you learn about it. What's really cool, my cheater, I mean, I'll give you the cheat code. But okay, so when I do this, I use a vein light, VEINLITE. It's like $500, maybe 600 on
Oh,
eBay, something like that. And it's a red light, like an LED light that glows up your arms so you can see where veins are. And even if you can see your veins really easily, my arm is really easy to see the veins. I'd still drop that vein light on there because I want to see which way it's running, and it glows up your arm where you can see the vein. Yeah, it's really cool. And
what do you mean which way it's running?
well,
Like which
just because it, like if you see the vein, I want to, kind of pull the skin from side to side and see how deep it is. And I
yeah.
want to see like if there's a spot that you see the blood vessel, what
Uh-huh.
happens if it's doing a sinusoidal curve like a
Yeah.
snake? And but I can see that. And then so I can pull it tight to see if I can get it straight, or I can find a spot where it's straight, or I know that I can't overshoot it because you might go into the vein and then out of the vein because it's on a curve. You know what I'm saying? So it really helps me
Right.
see it. And I use that. I've been doing it for what it is, okay, shy of 10 years. I mean, I think I might be coming up in the next few months on 10 years of doing this. And I still use the vein light so that way I can see in the hand. I could, because there are some bigger people and some people that don't have veins that are easy to find. And funny enough, if you're looking and tapping on the arm and tourniquet and all that stuff, and you can't find a vein, get the
Yeah,
vein
they
light.
used to have to use like what they would call, what is it, a butterfly or a baby one? They used to say, your veins are so small. We have to
Yes.
use this little special one. And I was
Yes.
like, I
Well,
don't know what you mean. Okay, whatever.
so I do use a butterfly with the vein light. And it's funny, by pushing with the vein light too on the spot,
Uh-huh.
it's regionally over those 2 inches. It's kind of pushing on that area. So that way, when I insert the needle, patients don't feel it as much. And here's something I hear regularly, not daily or not weekly, but maybe, at least once or twice a month. Why don't hospitals use this?
Why
And
don't they?
again, it goes, well, here's the answer that I give, just so that way you guys can, know the answer to give. But I don't know, I just say, here's the deal. The phlebotomists, they do 10,000 of these a month.
Mhm.
I do 1 or 2 a day. And so this is the equalizer. This helps me, like to where when I'm doing it, I'm as good as they're doing it. It kind of gives a little bit of credit to them, but I think it's a pride
Sounds like a
issue.
politically
It's a
correct
very
answer.
politically correct answer.
Yeah.
And I mean, you know what? People don't go, "Oh, I don't buy that." But,
No.
I no, people don't say that, so they must be like, oh, "Okay." Because I'm just, just saying, listen, most of the time, if you did 1,000 of these, a
Hmm.
week, you probably don't need this. I don't. I do 1 or 2 a day. So it's just
Hmm.
nice to be able to have this because it makes me good every time. It's like bowling with bumpers, and they get that, so it just
Yeah.
becomes easy for people to understand. It's just like, I could bowl, but when I put these up, then it doesn't matter how bad I am, it just makes a bad person better. And I'm glad this went well, because they're like, I'm a hard stick. They always have to, bring in people, and then I'll get it on the first or third time, or who knows. And they'll be like, wow, that actually was really good. You're pretty good at this. And I'm like, well, I am a doctor. No, I'm just kidding. I don't say that.
Do you say it? I also play one on
No,
TV.
no, I do not.
So do you do any sort of like public marketing? Do you talk about the benefits? Are you nervous about stating the benefits? Like you said, there's no science on necessarily the bone healing, but the soft tissue. Is this, how do you, because this could be a great competitive differentiator when it comes to your
Correct.
marketing.
Correct. We don't really use it as external, meaning like
Hmm.
I don't promote it outside, like, hey, come to us, we use PRP. I do wish that I could have a shirt that says PRP, yeah, you know me. I really want to do that. But um,
You're not
but
going to be at the workshop this March.
I know, and if I could just get a T-shirt, I don't know. Maybe that's my birthday gift from my team this year. Is, so everyone wears PRP.
PRP, yeah, you know me.
Who's down with PRP? Um, and but when the patients are in there, I explain it to them really simple. I just go, here's the deal. So we're going to pull this tooth. I'm going to draw your blood. We're going to spin that blood in the centrifuge here. 10 minutes later, I'm going to put it back in the extraction site. And that's going to make your wisdom teeth heal all the quicker. And it's going to reduce our chance of infection and dry socket. And they're like, no kidding.
Sold.
No, hold on though. I don't want, like, is that like, going to be an extra $500? No, it's $20. And they go, oh shoot. And I honestly think I could charge $80 and people would be like, oh, okay. These days, even $80, I mean, that's a meal for two, right? Someplace, so like that's still
one
doable.
Nowadays.
I know. Okay, Miss Seattle. Come to Burger King in Iowa and I'll buy you an $80 too. I'm just playing around. But how's that so funny? I don't know. But yeah. But yeah, so I basically just say, here's the deal. No big deal financially. It's $20. Honestly, I didn't even balk at it. If people said, I don't want that, it's like, okay, like I might on a good day just say, tell you what, no big deal. I'll just even give it to you. Cause it's really, it might be self-serving. It's just like, no, please let you heal quicker. If someone had a qualm with, like, I really hate having my blood drawn, fine. I'm not going to twist your arm, like, I'm going to put a tourniquet on it, but no.
Oh my God.
Right. But so if someone really hated the idea or they tested it, but it's just like, listen, I'm just trying to help you heal better. If you want to save the $20, go for it, I don't know. I just can't recall someone declining it. So, and they really shouldn't. My PRP is a bargain,
it is.
Yeah. And I put it around extraction sites. We talked about that. I put it into, so what you can do is you stir it for about, let's say 10 minutes or even 20 minutes. Sometimes you really have to stir it for quite a while to get the concentrate that you need. Because it turns out liquidy on top. The yellow stuff turns out liquidy.
Yep.
And you want it to be firmer. And sometimes it just doesn't firm up. So you put it in for more stirs and whatnot. But about 3 minutes in, you can pull it out and it's separated enough that you can pipette out a little bit and then mix it in with your bone graft material and then stir the rest of it. So and that makes you some sticky bone. The bone is kind of coagulated together. It sticks together. So that way you can put it in one clump, which is really nice to be able to put it in procedurally in one clump. And then the remainder, like, if you just siphoned off, half a cc, 1 cc, something like that to mix in with your 1 cc of bone, then you've got still, just about 1 to 1.5 cc's of bone graft slash PRP mixed together, and it's sticky bone. You put it in the socket or wherever you're, the deficient bone spot, and then you can use the remaining couple cc's of plasma that's now hardened up when you're done stirring at the last 7 minutes. So, 10 minutes total, for example. You've taken some out at 3 minutes, you stir the rest at the 10-minute mark, you take it out and you press it, and you can put a membrane over the top. So that way the bone graft material stays down in there. It's tamped down with a suture, and then the gingiva grow over the top and not down into the extraction site.
Wow.
Yeah. That's my grafting technique.
Sticky Bone is the coolest band name. So I want you to call up Dr. How do you say his name? Jason Estebabian.
Estebabian, yes.
We need to call Jason and tell him immediately. New band name, Sticky Bone.
Yep.
And second, that reads like a Julia Child recipe for how to bake a cake. It really does, because
you put it back in the oven for another 7 minutes.
Well, listen, I am a great cake baker, and the way her recipe separates the eggs. So you whip the heck out of the whites, and then you ribbon the yolks, and then you put them back together. Whereas American cake recipes, you just dump the egg right in there. So you're not separating it out. And that's exactly where my brain went. So the non-dental brain saw that as a recipe, and you explained it very well.
What did she used to say? This is glorious. What was her word?
She used to say bon appetit, but I don't remember what her phrase was.
It was either, fantastic, glorious, there's marvelous. There's stupendous. There was some word that she always would say, I don't know. I'll have to
I
look
don't
that
know.
up
Let me
afterwards.
text my husband. He loves Julia Child. I'll ask
Well,
him.
look at that. You just outed him. Oh,
I did.
Man.
I really did.
Yeah. All of his work buddies.
He's the best chef I know. That'll make up for that by far.
All right, fair enough.
Yeah.
And if anyone thinks this Chad in Iowa, he doesn't know what he's doing. Listen, if you're listening to this podcast, Bruce Baird uses PRP too. He calls it PRF. So you'll hear, if he says, yeah, you just throw that in there. It's true. I've seen him use it in his office. He's in love with it just as well. So don't think of this as just a Chad thing. If surgery people, man, I tell you what, if you're doing a sinus, any sinus work, you have to be able to, draw PRP and use that as a membrane cover. It makes stuff heal just so quickly. It's just so cool.
I look forward to the marketing campaign around it because it's We Slay Disease. And I think this is a really, really good tangible example that lay people who are not dentists can understand. And it's a great demonstration of you showing your compassion and your care for others. Great podcast.
That. Yeah.
Mm-hmm.
Well, listeners, get yourself a centrifuge. Go to a course and get a vein light. Go to a course to kind of learn some of the stuff that you learned with IV care in dental school, and start applying it. Shout out to Maggie Augustin, who has recently started using it as well, and she's now in love with it. So
yay,
you
Maggie!
Too, I know you too will be in love with it soon. Yep.
All right. We'll see you next week.
Thank you for listening to another episode of Everyday Practices Podcast. Chad and I are here every week thanks to our community of listeners just like you, and we'd love your help. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.